So definitely, there have been vaccines that have been delivered effectively. So the Ebola vaccine needs to be kept at very cold temperatures as well. And obviously that was delivered in Africa and it was delivered effectively. So these are challenges that can be overcome, but definitely makes how it's delivered and disseminated in the population definitely more challenging.
How is the US prioritising who will be the first to receive the vaccine?
Well, it's interesting because basically the CDC, so the federal part of the administration that's giving guidance, is setting out some criteria and guidance, but it's basically leaving it up to the states to make their own decisions. So it's talking about kind of one of the principles of the goals. It's to decrease death and serious disease as much as possible, so focusing on that. Preserving the functioning of society, so obviously looking at essential workers, and to reduce extra burden of COVID-19 in people facing disparities. So those are the overriding principles, but remember, it's going to be administered at the state level. This isn't a country that has a particularly well-coordinated medical system. So it's really unclear how that's going to be delivered. And for example, one of the things that has been considered top priority is vaccinating the US officials in the 3 branches of government, which is not something that I've heard of in any other country being a priority. So, we don't know how it's going to be prioritized.
Yeah, and that seems like a strange priority. I mean, obviously, it is interesting to weigh up, isn't it? So many countries are going down the path of elderly in aged care facilities and frontline health workers, which seems like a strategic move, but potentially there is something to be said for looking at essential workers right across the workforce.
Well, definitely. I mean, for a number of reasons. One is when you have a epidemic that's going full force, those are people that are going to be getting the disease and transmitting the disease. So it's a way of kind of stopping that disease from happening. But also, these are people that you're sending out into the workforce that you require them to work to keep society functioning. So you're asking them to take additional risks. So we do have obligations to protect those people and prioritize their protection when it comes to the vaccination.
Nancy, how long is it going to take for these vaccines to have an impact in places like the US, where the infection rate is just so high?
Well, the first thing people need to realize is you need 2 doses of the vaccine for it to be effective. They're 3 weeks apart. And so then you still need a few weeks after that for the vaccine to be fully effective. So you're already looking at least 6 weeks for really the vaccine to be fully effective. And then you have to actually vaccinate people. So you actually have to vaccinate a pretty high proportion of your population for it to be effective. That depends a bit on whether the vaccine stops people dying from the disease but doesn't stop people from transmitting the disease, or whether the vaccines actually stop transmission, so stop people from getting COVID-19 and passing it on to other people. As you can imagine, if it stops you from passing it on, it's going to be easier to stop the pandemic than if you get the vaccine, you don't die, which is great, but you can continue to pass it on to other people. Then it's going to take, you're going to need to vaccinate a lot more people before you really control things. So they're talking about needing to have 70 to 80% of the American population vaccinated. And that's a challenge anywhere. But, with the anti-vaxxer coalition in the States being quite strong and a lot of vaccine hesitancy in the States, I'm not sure how effectively they can get that 70 to 80%. Plus, this poorly coordinated medical system is going to make it a challenge as well. So sadly enough, I don't really think the pandemic is going to be fully controlled until the end of 2021 in the US, which is really frightening.
And it is interesting because it's such a difficult situation the incoming president is going to face. And as you talked about, that sort of ad hoc, uncoordinated system where the federal government isn't really able to impose broader measures to try and contain this. Without those broader measures, how do you contain it just with a vaccine?
Well, I think the federal government actually has far more control that it's been exerting in the United States. It just hasn't been willing to. So it's going to be interesting to see what Biden does in terms of trying to more effectively both manage the pandemic and manage vaccination programs. It is a federalized system, so there is a lot of control at the state level. But, this has been the federal government has abandoned all leadership in the United States in this pandemic.
Yep. Good to get your thoughts on this rollout. Thanks so much for joining us.
Thank you.